The muscles associated with the spine are important structures not only because of their biomechanical function and support to the spine, but also because of their involvement in the reconstruction and creation of corridors to reach different regions of the spine. In this model, we're gonna visualize the dorsal musculature from superficial to deep. This dorsal musculature can be divided into 6 layers, and starting with the most superficial layer, we have 2 big muscles. The superior one is the trapezius that attaches medially to C7 and runs inferiorly to the spinous process of T12, running anteriorly and lateral to the superior portion of the scapula and attaching right there. Now, inferiorly, we have this big superficial muscle, which is the latissimus dorsi muscle, and it also attaches to the spinous processes of T6 to the most inferior spinous processes of the lumbar region, which is L5. It runs superiorly and anteriorly and attaches to the inferior portion of the scapula and more laterally to the humerus. Let's remove this muscle and expose the rest of the deep layers, which are formed by muscles with smaller diameters and our dimensions. So let's start with the second layer, which is formed by the rhomboid minor and major, and anteriorly and superiorly by the levator scapular. So the rhomboid minor attaches to the spinous process of C7 and T1 and runs laterally to attach to the medial portion of the scapula, whereas the rhomboid major attaches to the spinous process of T2 to T5 and again runs towards the medial portion of the scapula. Moving anteriorly, we see that there's an inferior attachment to the scapula here by the levator scapular muscle, and it runs superiorly and medially to attach to the transverse processes of C1 and C4. Okay, let's remove this group of muscles and expose the third group, which is formed by a couple of muscles named the serratus posterior muscles. We have a superior and inferior serratus posterior muscle. The superior serratus posterior muscle is going to be attached to the spinous process of C3 to T3, and it's going to run laterally and attach, and it's going to be attaching to the second to fifth rib, whereas the inferior serratus posterior muscle also attaches to the ribs and named the 9th to 12th rib, and medially it attaches to the spinous processes of T1 to L2. Let's remove this muscle and move towards the splenius capitis and splenius cervicis muscle. So the splenius capitis muscle is a muscle that attaches superiorly and anteriorly to the mastoid process of the temporal bone and inferiorly and medially to the spinous processes of C7 to T3. And inferior to this muscle we have the splenius cervicis muscle, which attaches to the spinous processes of T3, T4, T5, and T6, and runs superiorly and medial to attach to the transverse processes from C1, 2, 3 to C4. Let's remove this group of muscles. And now we have a deeper layer of muscles, which is the 5th and 6th layer of muscles. These layers encompass or are formed by a group of small muscles that are going to be running from the most inferior regions to the most superior regions. And the 5th layer is formed by a group of muscles that is named the erector spinae. The erector spinae muscles are muscles that are attaching from the occipital and temporal regions, in this case the mastoid process, to the transverse processes of different regions and also the spinous processes. So these groups of muscles are the iliocostalis laterally, the longissimus more medial, and the spinalis muscles lying practically at a sagittal level. The iliocostalis muscle, which is the most lateral group of muscles, is formed by a thoracic segment, a lumbar segment, which is more inferior, and a cervical segment, whereas the longissimus muscles are formed by a thoracic group of muscles, a cervical group of muscles, and the most superior projection of these muscles or attachment of these muscles, which are the longissimus capitis muscles. And this has an attachment to the mastoid process of the temporal bone. Medially, we have the spinalis muscles that are going to be divided into the cervical region and thoracic region, as well as the most superior region that goes from C7 to T6 to the superior nuchal line and inferior nuchal line, which is the spinalis capitis muscle. So if we remove this, we're gonna get a view of the deepest layer, which is formed by the semispinalis muscle and the multifidus. So the semispinalis muscle, at least one with it's gonna be the biggest of this deep layer of muscles, the 6th layer, is the semispinalis capitis. This muscle runs from the transverse process of C7 and T6 to the superior and inferior nuchal line, whereas the muscles that are running from the lumbar region to the cervical region, called multifidus, are muscles that are going to be attaching from the spinous process, the most anterior portion of the spinous process, to the transverse process, and that goes from one transverse process and attaches to 1 to 2 segments superior to the spinous process. Now if we remove this deep layer and we move towards the lumbar region, the first muscle that we're gonna find right here is the quadratus lumborum muscle. And this is important, at least for a 360 understanding of different ways to approach the lumbar region. We remove this quadratus lumborum muscle. What we're gonna visualize is the psoas muscle. So basically, this muscle, you can see, it it is attaching medially to the transverse processes and even part of the body of the lumbar vertebrae, and the attachments of this muscle and the muscle itself lies anterior in a coronal plane, lies anteriorly to the lumbar plexus, the exit of the lumbosacral nerves, and this is going to serve as a muscle that is protecting these nerves. And inferiorly, another big muscle that is gonna be part of or is gonna be associated with the stability of the sacroiliac junction is gonna be the iliacus muscle.